Today we're here with Dr. Warren Line, and he is an ENT on staff here at Providence St. Joseph Medical Center. Dr. Line, can you talk to us about the number of people that are experiencing different types of head and neck cancers?
Head and neck cancer accounts for 9 to 10% of all types of cancer that are diagnosed in this country every year. Here in Burbank, in Southern California, we have consistently hit that goal. We have about 9 to 10% of the cancers that we see at the Disney Family Cancer Center are head and neck type cancers. That includes not only cancers of the mouth and the throat, but also thyroid cancer.
Can you tell me a little bit about what types of tests or screenings are done to help identify or diagnose head and neck cancer?
Well, screening is probably the most important part of getting ahead of head and neck cancer. Screening is done very well by primary care doctors and dentists. Often they will identify area that they're concerned about and then refer to the ear, nose, and throat specialist or the head and neck surgeon. Once the patient comes to see us, the key to diagnosis is just a very good exam, looking around in there, feeling the neck. Often leads to a biopsy. That may be taking a little piece of tissue or sometimes a needle biopsy. With thyroid cancer, we've seen a big uptick in the amount of thyroid cancer, in particular papillary type of thyroid cancer. But with head and neck cancer, with oral and throat cancer, the greatest concerns still remain smoking and drinking. The new problem that accounts for almost 40% of the head and neck cancers we're seeing is the HPV-related cancer. That's the human papillomavirus. There's been a big uptick in the amount of human papillomavirus-associated head and neck cancers that we're seeing. And the good news is that they're very treatable.
And what treatment options are available to treat these types of issues?
After we see a patient and do a complete examination, they generally have to have some type of imaging, CAT scan, MRI, something like that, to determine where the tumor is and if it has spread to other regions. Classically, treatment is based around surgery, radiation therapy, and chemotherapy. Traditionally, surgery has been the best choice to actually carve out the cancer. The problem is you often lose function. If you're taking out parts of people's mouths and throats, it can interfere with their ability to speak and swallow. The use of combinations of radiation and chemotherapy have been very effective in preserving those organs and allowing us to get equally good cure rates.
Can you share some of your expertise or qualifications in this area?
Here at Providence St. Joseph Medical Center and at the Disney Family Cancer Center, which we're affiliated with, we have cutting-edge diagnostic and therapeutic equipment. We can provide coordinated care, largely because we have nurses that are dedicated to coordinating that care for our patients. These nurse navigators help arrange the tests and get the patients through what is usually a pretty difficult time in their life. The other big advantage is that we have a very caring environment here. A faith-based institution like this affords us the opportunity to really treat the whole patient. Sure, they have cancer, sure they have medical problems, but there's a person inside there too that really needs to have their important issues, whether they're spiritual or psychological, those issues need to be addressed. And we're able to do that very effectively here.
Dr. Line, can you tell us how our Center for Integrative Medicine helps benefit patients who might be going through head and neck cancer treatment?
There's a unique problem with providing radiation therapy to head and neck cancer patients. In order to get the patient to hold still and be in exactly the same position for every treatment, which can run to 30 or 40 treatments, their face is usually held down by a plastic face guard, something like you might see a basketball player wearing. It pins them in position and can often generate significant anxiety while the patient's wearing that and getting a radiation treatment. The Integrative Medicine department over at the Disney Family Cancer Center has found a way to control this anxiety. Combination of complementary or alternative therapies, including things like Tai Chi or guided imagery, relaxation techniques, running the gamut from physical therapy to supplemental medications, certainly has made that aspect of radiation treatment much easier to take. Now, our radiation therapy department is one of the only departments of its kind in this country that has a environment in the treatment room where the patient is set at ease with visual and musical cues. These are custom tailored to the patient when they walk in. A radio frequency system senses who the patient is and provides music and lighting and imagery to help them relax to get through these treatments. It's very effective.
Well, why should a patient choose to come to Providence St. Joseph Medical Center?
The Disney Family Cancer Center and Providence St. Joseph Medical Center have the advantage of a very experienced staff of physicians and nurses and therapists who are able to provide highly coordinated care in a very caring fashion. We have extremely modern equipment, doctors who are really dedicated to treating and curing cancer. And I think that's reflected in the fact that our control and cure rates exceed those averages of the National Cancer Institute. We have a good program here, and it's only getting better.
And is there anything else you'd like me to know or anything else you'd like to add?
A lot of work has gone into developing this cancer center here. It really is a center of excellence. There's nothing else like it in the San Fernando Valley. And we draw patients from as far away as Thousand Oaks, Simi Valley, Valencia, because of the high quality care we provide and also the caring environment that exists here.
Great. Thank you very much for spending time with us today.